Please watch this interview with Dr. Jerry O'Daniel out of Louisville, Kentucky. Wow, wow, wow. You guys, like the amount of things that we learned last night on this live with him are mind-blowing, especially if you're getting your neck done soon or you're concerned about this area.
Okay, Deanna. Well, I'm a plastic surgeon that's triple board certified, ENT, facial plastic surgery, general plastic surgery. I have fellowship training in craniofacial surgery ×2, facial nerve surgery fellowship, a pediatric plastic surgery fellowship, and a PhD in anatomy and an MBA. So I'm a chronic student. I left academic medicine after 6 months because I wanted to be on my own, took over the chief of pediatric plastic surgery.
Wow.
And got tired of going to the hospital maybe 15 years ago. And I've been just doing facial aesthetics since then. I've always done facial aesthetic, but I have now just concentrated on that. So my background has been head and neck surgery and facial surgery for a long time. I don't want to say how old I am because then it'll be this ageism will kick in.
No ageism here. That's for sure.
And I'm in Louisville, Kentucky, by the way. I'm from Louisville, from Kentucky. I was never going to come back to here. And then once I started living in different parts of the world, Pittsburgh, New York, DC, Taiwan, I said, doesn't matter where you go, that's where you are. So the opportunity to take over the position of chief here, I came back to do that at a very young age.
Amazing. Well, Cheers and Spirits just commented, that's quite a CV. And I would say, yes, that's quite a CV. Lots of education. And I also think I heard you say you have an undergraduate in fine arts.
I started off in art school, and now it kept me from flunking out because I was a wild child. I started college when I was 17 and quite young, from a town of 4,000 people to a campus of 23,000 people.
Oh, yeah.
I left, but I was always liked science and always wanted to be a surgeon. And I realized I didn't have enough original ideas to make it as an artist because you really have to have some special ideas. I could plagiarize anything. I could copy the Grand Masters, but I couldn't come up with my own ideas. And I've done that in plastic surgery. For the most part of my career, early, I was learning what other people were doing. In the latter part of my career, I've taken all of that, and on their shoulders, I've seen farther. So I don't know if it's really plagiarism, but I borrowed everybody's ideas to create my own.
Absolutely. Well, thank you for telling us about yourself. I'm going to jump right into the questions. So the first question is, how do you personalize each facelift so patients still look like themselves, but just refreshed?
I've got a very specialized method of doing this. I've actually talked about it 30 years ago. I published a number of articles on it where I have people bring the pictures in when they're younger, each decade of their life up to their current time, and we scan those, put them on the computer, put them side by side. We educate the patient, telling them what they see and why they see it, and then we give them some idea of what we're going to do. We don't tell them how to make the clock, but we tell them what time it is. I then take these same pictures at the time I'm marking the patient. It takes me 30 to 45 minutes just to mark the patients before surgery because when you lay down, it all changes. And then in the operating room, we have these pictures on the wall spread around. And as I'm sculpting the face, I will make sure that we're using those pictures to use as our blueprint, as our prototype of what we're trying to achieve. Every face is different. If we were all made from the same mold, there would be no such thing as beauty. So this unique characteristic of each face needs to be preserved, and we have to make sure we don't lose it. I mean, think about the people who no longer can make a living with their face because somebody made them different.
Yes. Well, I love that. That's amazing and I love that you point out that it's actually our uniqueness that makes us beautiful, right? So if everybody started to look the same, either genetically or through plastic surgery, I mean, what's the standard of beauty, right? You're beautiful because of who you are. Okay, the next question, and this one came from somebody in the comments, is does Sculptra affect a facelift or filler? And what's your take on this? Should we be getting fillers? Should we dissolve them before? And what about Sculptra?
So I've talked about energy devices in peer-reviewed journals. I've just finished 2 book chapters and a book that talks about what to do with fillers and to do with these previously non-surgical treatments. So first and foremost, if Sculptor's done the way that we've published, if you put it supraperiosteal with a high dilution, you don't create the fibrosis and scar tissue that can compromise a facelift. When it's put in a more superficial plane between the muscles and the fat, where the movement of the face, when you're afraid to put it on the bone, which a lot of providers somehow are afraid for the needle to touch bone because it's scary, but that's where it needs to be. If you put it in with a lower dilution, then you can also create granulomatous tissue. So I don't find, and I work around it. I see people all the time with Sculptra. We do it all the time. I like Sculptra done appropriately. Now with fillers, that's a different animal. Hyaluronic acid, I would say 95% of our patients have had hyaluronic acid. There's three things to think about. Number one, if it's around the eyes, it creates a Tyndall effect, which is puffy, kind of a bluish hue, and because it happens for three reasons. Number one, the skin is very thin. Number two, it happens because it blocks the lymphatic flow around the eyes. The third reason it happens is because it's hydrophilic. It loves water. So it accumulates fluid, water, and it gets puffier and makes the bluish hue. And the eyes, I prefer to melt it before surgery. I prefer them to see what it looks like before surgery because it's unpredictable. The most bitter people in my practice are people that had filler in their eyes and they don't like it and want me to correct it, but their perception of themselves and what's normal and the predictability of me creating or correcting it is more difficult. Now, around the mouth, it's a different story because it creates a longer lip, kind of a duckish lip, a distorted lip, and it distorts the movement of the face because it migrates from the lip itself, where we put it in the red, it migrates into the periphery, can affect the smile. So in the ideal world, if I can, I like to melt the filler before surgery because what we see in people who have a lot of filler in their mouth is that not only does it distort the way it looks, when you dissolve it, it distorts the normal architecture and collagen makeup of the lip. And I also suspect that the hyaluronidase that we use to melt it also melts the normal hyaluronic acid in the cellular makeup of the lip. So I like for people to see how dreadful the lips are when the filler is gone before I do the restoration. And my restoration includes lip lift with microfat, with sharp needle infiltration into the rhytids, the wrinkles, as well as the nanofat for regenerative purposes, and then most often a CO2 laser that puts down 16,000 cores a second, and then I put nanofat into those cores. Around the periphery of the face and the cheek, you can't make it go away. It gets larger in time. When I try to melt it, it looks lumpy and bumpy. I recommend that we just ignore where it is in the face and we just live with it during surgery. The last thing to tell you is about permanent fillers that are done. Most of those people I see have come from another country, South America predominantly, or Asia. Permanent fillers that have been used, and a lot of times they're illegal, create a nightmare. And the big thing there is you have the risk of the facial nerve being injured. And similarly with Radiesse that's injected, it also creates a phenomenal reaction of scar tissue that makes the surgery very hazardous for the doctors who are not aware that the facial nerve can be engulfed in the fillers. And it's hard to separate the tissues.
I think this is such an interesting topic because people are actually getting, and this goes to a question that somebody has. I feel like women and men are getting facelifts earlier now and kind of bypassing the filler, where for years prior, in my life, I filled this space up because that's all I thought I had, right? And now I'm realizing, oh gosh, what a nightmare that I've created for the surgeon. So the question really is so should somebody get a mini facelift at a younger age or wait for the facelift? And I know some of this is personal opinion, but from your standpoint, what is the best way to attack aging?
So actually, I don't operate on age. I operate on anatomy. The youngest facelift I've done is 17. The oldest I've done is 87. And I didn't operate on because they're 17 or because they're 87. I operate on despite their age. So if I see anatomy that can be impacted with filler around the lips if it's subtle, or sculpture to the mid face because it's hypoplastic, then I would consider that. If I'm looking at the lower third of the face where the buccal fat pad is here, or the glands are large, or the neck is full, and you're 17 years old, I'm going to recommend surgery because I can't change it any other way. So I'm looking at the anatomy, not the age, and that's the way everybody should look at it. The difficulty is the majority of the providers, both doctor and non-doctor, are not as well versed in anatomy as ideally we would love for them to be. And the difficulty there is that getting the education, the hours, the experience to learn the anatomy so you know the topography of what you're looking at when you're looking at a face. You can just look at the face and know what's under the skin. That takes a lot of experience, it takes a lot of dedication and a lot of education, which is unfortunately in this world is missing. Because remember, there are more Medi-Spas than there are McDonald's in this
I
country.
know. I know. And that leads right into another question that somebody had about surgeons. So when we're looking for a surgeon for whatever procedure, the facelift, or maybe it's a rhinoplasty, what would you say, and I'm sure it can vary quite a bit, but what would you say is the number of surgeries that that doctor has performed for a patient to feel comfortable? So for instance, some of these recent plastic surgeon graduates, or whatever the correct term for that is, maybe they've only done 5 on their own. Do we feel, where do we start to feel comfortable, and what should we be looking for in experience?
So, this is a really, really good question. I've been trying to address it. I consider myself a de-influencer. My business is what it is. I've come online because of all the noise that's out there. And for the consumer, it's so hard. It's almost impossible because we don't know what I hear the words from people that I know well, and what they say and what they're doing, and they don't coincide. They're contradictory. I listen to young people saying things that anatomically don't make sense. And the consumer is listening to it, and everybody wants to believe in Santa Claus. They want to believe that there's a free lunch around the corner. The check is in the mail. There's just certain things that are not true, that those are myths. So to find a surgeon that has the experience, that thinks that you think you can trust, is a very hard task for the patient, for the consumer, because there's so much noise out there. And these people on Instagram, more or less, if you say it, they assume that it is true. And
Yes.
they capture the truth, and nobody really owns the truth. So if I were a client and I were telling you what to ask for, is first and foremost, how do you know what you're going to do to me? And this doesn't mean I've done 1,000 facelifts. Well, I did 1,000 facelifts the same way I did 30 years ago. That's not the person you want.
Right.
I change every 6 months. I'm always trying to improve what I'm doing. So if you did 5, it takes a while to figure out the anatomy. It's not really the number per se, but how are you evaluating it? So first and foremost, if you go to an orthopedic surgeon, they get x-rays, they look at the broken bone, at least they're doing a diagnosis. You go to a plastic surgeon, how are they diagnosing your problems? Are they listening to what concerns you? And are they describing what the problem is? And then the solution, does it make sense? And then when they say that, you say, okay, I want to see patients that you've done that look similar to me, because uh, I have 10 different facelift techniques that I will do that are the beginning of the algorithm that go from 10 facelifts into an infinite number of variations. So ideally, you say, look, this is what I used to look like. Can you make sure I don't look different? And what I found interesting is a lot of doctors are intimidated and won't look at those pictures, and they'll dismiss you if you bring pictures because they say, well, you're expecting too much. You'll never look like that. And so the key is, we're not trying to make you look 18 or 28 or 38 or 40, whatever your age will be. We're making sure you don't look like a different person by looking at what you used to look like. Because remember, Deanne, we never step in the same river twice. The river's always moving and we're always changing. So we can't give you back yesterday. But surgically, I can look at your pictures. A good surgeon can look at your pictures and then design the operation to make sure you don't look different. By looking at the x-ray, we know which bone's broken and we know which technique can fix the broken bone. That's the only diagnosis we can do as surgeons, is look at the pictures when you were younger, use those as our guide to do the surgery in the future. And then, we talk about board certification and all these questions. You know, I hear people talking about what their certification is, and there are dermatologists that are calling themselves plastic surgeons, facial plastic surgeons. And they belong to some obscure academy, and when you hear them talking, I mean, it sounds like they come off of an ER or the TV show, but that doesn't really give you any information about what their true credentials are. It's a difficult task to figure out that answer to you. And I wish I could give you an easy answer, but that's where I start. How much experience have you had by looking at their pictures, not just 1 month, 3 months, 6 months, but I want to see what it looks like 4 years, 5 years, 10 years. I show 30-year results on my patients. You do nothing, this is what you'll look like in 30 years. Not everyone can do that, but
Yeah.
that's where you should start.
I love that. And I think for the consumer, it's so hard because there's these marketing terms. There's the ponytail lift, the mini lift, the deep plane, the smaz, everybody has their own name, and we don't know what the heck it means. And then we're looking at before and afters. And now with the filters, you don't know really what you're looking at, right? So in that vein, will you tell us a little bit about the difference between a deep plane and the smaz technique?
Okay, so
Or is it different? I don't know. Maybe it's the same thing.
I'll break it down for you and make it real simple. And this is something that we're really fighting within our specialty, because I do a lot of lecturing, and some of the older guys like me, these terms mean nothing to us. Most of them are marketing terms.
Yeah.
I mean, and when you ask these people, what is that lift? Well, it's really just this. It's just and the whole idea of a deep plane facelift has been brought to our forefront by some social media geniuses. However, it was first described in 1974, so it's not new. So a deep plane, it means that you're operating under a layer of the face called the smaz. The smaz is superficial musculoaponeurotic system. Now, the reality is we recently know from our publications is there is no such thing as the smaz from in front of where my beard stops, and out here, there's no smaz out there. That's just muscles and fat. But now we're married to this term, deep plane facelift. So really the word should be, are you going superficial and above the smaz, doing application or a skin type operation? Are you going under the smaz? So if you're going under the smaz, that means you're going to be looking at the facial nerves, you're going to be under the facial musculatures, over some of the muscles, and you're working with a thicker flap. Now, the reality is, there are lots of techniques with lots of good plastic surgeons. When you listen to Instagram, there's going to be guys say, well, there's only 5 people in the world that really know what they're doing, or there's only one, it's me, or there's this. The reality is a good surgeon can use their technique and get beautiful outcomes. I just had a meeting that I co-chaired in St. Louis with 21 of the best plastic surgeons in the world from 11 different countries. 400 people from 65 different countries participated. And these surgeons were all high level attending and high level participating. 21 surgeons with 21 different ideas about the right way, the best way. And you look at the results, you look at all of them, guys, you go, all of them are great.
Yeah.
What's different is their interpretation and how they're using that operation for that particular patient. So it's the name. Really, the name is in the surgeon's reputation. Can you trust them? That the secret ingredient is the surgeon, not the name of the procedure. But we're so caught, the consumer can only get past the name.
Well, and we're not medical professionals, so whatever somebody tells us or market it is as that's what we believe. That's what it is to us. So.
Absolutely.
Okay, let's talk a little bit about the neck, because when I look at your before and after pictures, when I look at the necks that you do, I'm just like, it's out of this world how amazing people's necks look after you get your hands on them. So, do you address the deeper structures like the platysma muscles differently than a traditional lift?
Okay, let me give you a quick anatomy lesson.
Okay, love
That'll
it.
help. So when you look at the lower face, and I'll share these papers with you. I've written these papers about to help doctors understand this, and it's pretty simple for everybody. So you've got a jawbone, which is your mandible. The mandible's a fixed container. It's called a 1 liter Coke bottle. And then you've got the neck, and the neck has skin. It has fat under the skin. It then has a platysma muscle, which is a superficial muscle. Then you have another layer of fat. Then you have another layer of muscles. You have another layer of glands, and then another layer of muscles, and then a bone. So the key is, will all of those things fit inside the container? If you've got a 1 liter Coke bottle and you have 1 liter of Coke, it fits together perfect and you have a neck like Jessica Alba. Okay? It's
Right.
perfect because you have a volumetric balance. Now, the platysma is a very, very thin muscle. And Arnold Schwarzenegger, the Mr. Olympian, his muscle is probably only 2 to 3 millimeters thick at best. And so what we're seeing is a lot of the plastic surgeons are trying to take this platysma and they tighten it with the idea that they're going to lift or create a hammock or going to create this or that or the other, a setback by pulling this muscle really tight. And it's going to push all that content back in the mouth where the tongue is moving. The mouth is always going. When you're eating, every time you eat, you're pushing all that content down. It'll look awesome for Instagram for about 3 months. You might get 6 months, and in the right patient, you'll get more time out of it for sure. But in a person who's got a little bit of enlargement of the deep gland, the deep structures, including the gland, most importantly the gland, the muscle, and the fat, it's not going to last. You're going to get good results for 3 months, 6 months, at a year. It's going to start to fail. Now, the other failure is going to be in the bands that you're talking about. So the platysma creates these, in the country they call them leaders, they're bands, but this is a huge muscle. So
Oh, I
so
didn't know.
the platysma, the inside of the platysma is here. It goes to the jaw. The middle of platysma starts down on your deltoid, goes all the way to the corner of your mouth. And then the third part of the platysma goes to your ear and goes across your face. So the platysma is not one muscle. It's actually 3 different muscles with 3 different functions.
Wow.
So therefore, you have to understand that anatomy, because if you're trying to pull over here and affect this medial band, this inside band, it does not work. If you're trying to create a corset to tighten this inside band and hold everything up, it's not going to work. So what you need is volumetric balance, number 1, which means that you have to go into the deep aspect of the neck. My evolution in neck lifting goes back 25 years because I kept failing with my platysma, and people would come back and they say, my neck is not as good as I want it to be. And I look at them and say, you're right. I like to listen to my patients. They tell me what's right and what's wrong. And I said, I'm not working. This isn't working out. I'm an anatomist by training. I was had access to the universities, and I was treating anatomy or teaching anatomy around the world. So I was play around the cadavers and understand what the muscle is. And I ultimately taught myself how to reduce the muscles and, more importantly, reduce the submandibular glands. So there's maybe 3 or 4 or 5 of us in the world that were doing this 10 years ago. And we were teaching people and we were trying to justify what we were doing. We were writing papers saying, this is why you do it. This is why you do it. This is why you do it. In fact, 3 years or in 2018, I was on the stage with a really close friend of mine, Tim Martin, and Francisco Bravo, and one of the most famous people in the world, Dan Baker, stood up and said that you all are doing, this is malpractice to do this, and said this in front of 2,000 people, and to say what we were doing wrong. So that anchored us at malpractice. Now, Deanna, fast forward to 2026. You go on Instagram now and you'll see that everybody is talking about submandibular glands.
Everybody. It's
And
one of the questions. Do you remove them? Do you keep them? It's one of the questions.
in the last 18 months, I've gone from talking about why we do it to now I'm espousing safety. I've done over 2,000 glands in my lifetime. I have patients. I have a paper coming out with over about 1,082 glands that we've reduced, and I'm creating an algorithm so that young, inexperienced, or even older, just inexperienced surgeons can do it safely, because it's not a safe procedure if you don't know how to do it. There's a handful of us who've written all the papers in the last decade and a half, and our complication rate is nil. But we've gone really slow. We've helped each other in the cadaver lab, and it took us 25 years to learn how to do it. Now and when a customer walks in and asks for it, the person says, well, I really don't know how to do it, but I'll do it anyway.
Yeah.
So I do it in my cases probably 95% of the time, but my patients are going to be self-selected. They're self-selected because 2/3 of my practice is revisional. So they've had surgery somewhere else and I'm trying to fix it. And that means that the glands have got to be managed because they've had either or and energy devices and surgery. The other reason are people are coming from around the world because they know I can do it safely. So they come in and they're self-selected. So my percentage is going to be 95%. The other 5% that are not getting glands done are people I'm doing facelifts on that I did in the past, and they're getting their next facelift. So I've been doing glands slowly and now all the time. And what I do, I've got a book coming out on this. I've had 3 or 4 papers that are coming, book chapters and papers coming. And what we're pushing out is safety because what's going to happen, I'm afraid, and I talk about this, I've done editorials, that the submandibular gland reduction has been safe to this date, but it's going to turn into the Brazilian butt lift of years gone by
Yeah.
because Brazilian
With
butt lift
everybody's,
used to be safe.
yeah. So what would like if somebody's not trained and doesn't do it right, how does that affect the patient long term?
Well, let's talk about short term because I think my concern is going to be short term risk, which is going to be bleeding. The submandibular gland is a very vascular structure, and more importantly, it sits in the part of the neck where there's lots of arteries and veins with large Latin names that bleed profusely. And unless the person is conditioned and knows how to control the bleeding, it could be catastrophic. The second reason that we're worried about it is the inside of the gland has large vessels, and you have to know how to control those blood vessels to seal those blood vessels so that they don't bleed after the surgery when they go home. And that bleeding can happen up to 2 weeks after surgery, and it could be catastrophic. So that surgeon needs to know how to do it. The second thing we worry about are some of the nerves that are around the gland. Most importantly, the gland that moves the tongue, that sticks it out. The second one is going to be the nerves that pull the lip down. Now that nerve, it will regenerate. Lower lips will always come back. You could potentially get a permanent facial injury, but that's going to be very unusual based on our studies. The third thing is you could get the gland leaking because it makes saliva. So when it makes saliva, it's supposed to come out of the mouth. But when we're reducing, we're not taking the whole gland out, but when we're sculpting the gland to fit inside the container, there's an area where the gland can secrete and lose fluid, the saliva, and that saliva can build up under the skin, and then you have to manage it, and it's really, really hard to manage. I mean, it can take months to fix it. And then the last thing that we worry about is a dry mouth. Now, to date, I've never had a dry mouth that's permanent. My friends who probably make up 80, 90% of the glands that have ever been done in the world have not had a dry mouth. But it still is, even though we don't have experience with anybody that we know has had a dry mouth, it still is a potential risk, meaning that your mouth feels like you need to have water around all the time. And then the last thing is inadequate reduction. That's what we see most often. Somebody goes in and takes a little bit out, and they said, well, I just took a little bit out. It's like being a little bit pregnant. It's all or none phenomenon. There's a certain amount that's got to come out, and you got to take that out.
Yeah. And so basically by removing it, you're just getting more of a snatched jawline. Is that the idea? Or is it down here?
It's going to be, so you got 3 zones. You got the central zone where you're going to have an angle of about 120, 110, 120 degrees. As you go to the mid portion of the jaw, there should be a nice deep shadow that gives you a great jawline. That angle should be around 80 to 90 degrees. And then when you get back to the corner, what we call the retromandibular angle or this angle, that should have a deep shadow as well. So you've got this affected by deep fat, this is affected by gland, and this is affected by the parotid and the absence of a jaw. Because as we age, the jaw goes away. Yeah. So it's going to be this mid zone that you're losing that shadow. So the snatch is all 3 shadows together.
Gotcha. Okay. And in the, okay, so a couple comments. People said, thank you so much. They're learning so much. People have already said they're going to call to get a consult with you. So those are the comments. And just to be mindful of our time, I'll ask 1 or 2 more questions. We talked a lot about the neck. There was some more questions about that. Another question was, what type of drains do you use? Do you use the netting? And then also a question on anesthesia.
All right. I'll start with anesthesia. It depends on the patient and what they do. 90+% of our patients, we use what's called TIVA, total intravenous anesthesia. So we don't put a tube down your lungs. We don't breathe for you. We're fully capable. We have a Class A facility. I use something called Precedex. Dexamethasone is the generic name. We published the first paper in the world on this in 2006. I just published another paper of 800 plus consecutive patients. I'll send those to anybody that wants them. And so we use that to sedate. So we're limiting opioids. We limit benzodiazepines, which recover. We're able to limit the amount of propofol, and we avoid inhalation agents. Some patients, I will use what's called a laryngeal mask or an LMA with that same anesthesia, but that's just to control the airway so they're not snoring. In certain percentage of patients, we'll use a general anesthetic. Those are going to be people who have obstructive sleep apnea, and we don't want to have any airway compromise. And they make up about 2 to 3% of our patients. So over 90%, we're using IV sedation. I don't do straight local because I need to concentrate. I don't need to be entertaining my patient when I'm working. Now, the other question was drains versus net. So I used to use drains and tape and glue, and I did that for 20 some years. 10 years ago, I adopted a method called the surgical net. I met Andre Arsvald when I was lecturing in Brazil in 2016, and he was doing deep neck and he was doing this netting. We evolved together with the deep neck, and he also convinced me to start using the surgical net, and it changed my life. I've written 6 or 7 papers now on the surgical net. So the surgical net eliminates drains, it eliminates dressings, it eliminates glue, it eliminates the risk of bleeding while the net is in place, it eliminates seromas, while in my practice just about completely. And seromas are fluid collections under the skin. We have proven with papers using good science that it does not compromise the skin. We have published papers that it does not create scarring, and now we have a paper coming out where it shows that the surgical net speeds the recovery because it eliminates fluid collections under the skin, it speeds the deposition of collagen, and it eliminates inflammation. And we're doing that in an animal study that compares one side with and one side without the surgical net. So I've been doing that now for 8 or 9 years, and not only we are using it for face-ups, we've developed with Fausto Viterbo brow lifts. I've invented a lip lift that corrects these beavers that are walking around. People walking around like rabbits, with the lip that's lifted like this, and then you see it going straight down on both sides. It's ubiquitous. It's everywhere.
Yeah.
And so the operation now, I can at least get the corners up. You're still a little short, but you don't look so much like a rabbit. So I love the net. That's what I'm using. And that interesting around the world, the rest of the world has accepted it, and 75% of the people in Brazil are using it. Now, American surgeons are starting to use it, and they're actually calling. I've been on all the interviews because we're so arrogant that we think that we're the only people who can do anything, not just in surgery, but everything. And now they're all going, well, maybe there's something to that. Maybe tell me about that.
Yeah.
And this is just happening in the last 12 months.
I gotta say, you're absolutely fascinating, and all of the papers and all of the research. I hope that we get the chance to do this again, but I have a couple more things. So one, Maybell and Mom asked, how far out are you for surgeries? And then if you could tell everybody how we can get a hold of you for a consult. Do we do that through TikTok, or what's the best way to get a hold of you?
The best way to get a hold of me, I'll give you my number, my country code 1-502. What's my number? 584 1109. You can go through O'Daniel Studios, or you can go through my Instagram, or you can go through TikTok. And my Kara she's my go-to. She keeps me in line, and she looks at everything. So she has her finger on the pulse. I'm
One more
too.
quick question just came in. Better healing with hyperbaric chambers, red light, thoughts on that?
The HBO I've used off and on. The science doesn't support that it speeds wound healing. My friends who own chambers tell me during cocktail hour that it's great for their bottom line because they do add-on charges. My academic friends who work in centers, they don't see that it speeds recovery. If you have compromised skin after from a smoker or the skin's not healing well, it can improve healing. It can improve smokers, Raynaud's disease, small vessel disease. It can speed that. There's no science to suggest it speeds, but it's out there in Instagram now, and my friends who own the machines talk about how much extra money they make. So, for me, I have plenty of space. I could buy one. They're not expensive, but I have trouble offering things if I don't see full value.
And I think on your TikTok you gave a little tour of your facility and your office. It's absolutely gorgeous.
Thank you. It's a
Yeah.
lot of thought goes into that.
And if somebody wants to schedule a surgery, how far out are you?
We have spots. We're scheduling probably a year out, but we have spots here and there always. Uh, I've been traveling. I had 8 meetings, 8 countries I was going to the first 6 months of this year, and I'm burning. I'm trying to back off some just because I want to stay home.
Yeah.
So we're
Well, good.
opening up dates because I'm actually backing off some of my trips.
And then the last question is, if we come from out of town, how long do we need to stay in Louisville for the aftercare portion?
Well, 2/3 of my practice is national, international. So when I have someone that comes internationally, I like to get 10 days in the office. This I just saw somebody from who flew in. She's going to leave in 7 days. That's a little quick, but she's a revisional surgery, so 7 days should be fine. If I can get 10 days, I love it. We're fully set up for people to travel. I've had somebody from England came and they liked it so much they stayed 6 weeks. Um, I actually have somebody right now she's been here since January using this as her home base. She got caught she was in Kuwait when the war broke out
Oh, oh gosh.
and so she was able to get to Riyadh and make it back here for her appointment on Wednesday. Last Wednesday. So.
Wow. Wow. Well, maybe people are going to be moving your way, right?
Uh, you
Get
know,
into Kentucky.
Kentucky is an interesting place. I was never coming back, but it's such a beautiful place, and it's
Oh,
been.
yeah.
I just did somebody who's, she had came here for repair. She said I could never go to Kentucky. I can't spell it. Who would ever go there? She's European. She lives in Hollywood, New York, etc. But she didn't have a good experience with her outcomes, so she kept getting referred to Kentucky. So she's like, I'm coming. No, I'm not coming. She goes somewhere else. I said, all roads led back to you because you're kind of the fixer upper. And then she got here, and after was going to stay a week, she ended up staying 2 weeks. And when she left, she said, "Oh my God, I love this place. Can you find me a rich older man so I can come live here?" So
Well, I have some friends that would take you up on that. If there's rich older men hanging out in Kentucky, just let us all know here in the chat. I think some hands would be raising.
well, I'm an older man. I don't know if any of us are any good anymore. So
Well, everybody in the chat says thank you so much. We've learned so much, and what a pleasure. It was so nice to meet you.
yeah,
Have a
nice to
great
meet
night.
you. I'll have Kara drop you a folder. You can read all the articles and lectures. Bring yourself up to speed.
I would love that, and absolutely need to. Thanks so much. Have a great evening, you guys.
Thank you.
Bye, everybody. Thanks for joining, everyone.